In the United States, the number of fentanyl-related deaths has continued to rise, causing nearly 92,000 deaths in 2020, according to the Center for Disease Control and the National Center for Health Statistics. Every community has felt the effects of this increase over the last few years. People of all ages worry for their community members, their friends, and their family. Everyone here knows someone who has or does struggle with addiction. For me, my first experience with addiction in my community was as a junior in high school when my NHS group decided to do an item drive for a local rehab. One of the most prevalent things that we heard from people while we were there is the reluctancy that people have to help them due to their misunderstanding of addiction or other biases. By advocating for more inclusive and consistent education regarding addiction, Narcan, and how ordinary people like you and me can help, the death rate of fentanyl and other opioid-related deaths will begin to decrease. Across the United States, people have lost loved ones, children, spouses, and friends to the devastating effects of the opioid epidemic. The epidemic has no limits as to who it will affect, but by knowing the warning signs and symptoms, you can help to keep those around you safe and not allow an overdose to be the end of a life. It is important to understand who is the most at risk to develop an addiction. Those people are young adults ages 18 to 25, those who struggle with a previous mental health disorder such as depression, anxiety, and PTSD, or anyone who already has a history of substance or alcohol abuse. The warning signs that someone may be overdosing include pinpoint pupils, unconsciousness, slow or stop breathing, and bluish skin. Once you know the warning signs, it is important to think about the resources available to you at that time. There are various online and in-person trainings that civilians can take to learn about how to safely and effectively administer both nasal Narcan and intramuscular Narcan. The online community teaches how to administer different types of Narcan as well as basic instructions for performing CPR for anyone who is not yet trained. All of this and more is taught through the community first responder online training. There is also in-person community first responders that have been seen to be effective in the United States as well as across the world. These outreach programs teach how to administer Narcan, what to look for in someone who is overdosing, and basic CPR or chest compressions. The Substance Abuse and Mental Health Services Administration also has a helpline that can be dialed from anywhere in the U.S. at any time. The number is as followed: 1-800-487-4889. Sometimes it is too late to call a tip line or refer to other services, and the only one to help in an emergency situation is you. It is important to know that you can and should do for someone in the case of an overdose. When you are worried that someone has overdosed, it is important to remember to first and immediately call 911. Naloxone can be life-saving, but those who have overdosed will require further medical assistance due to it wearing off in between 30 to 90 minutes. Then administer naloxone or another form of Narcan and begin chest compressions to the beat of the song Staying Alive. There are two different types of naloxone, a nasal spray and an intramuscular injection. The first step before administering either form of naloxone is to try to wake the person up. If they do not wake up, this is when you should immediately dial 911. Then give Narcan. Once administered, support ventilation through chest compressions. CPR can be performed with rescue breaths here, but it does not need to be, and performing chest compressions on an unconscious person in this state will never cause damage. Although it is ideal to wait for first responders to arrive on the scene, if for any reason you cannot, you can place the person in the recovery position, which is laid on their side with a knee supporting them. To administer nasal naloxone, remove one dose from the package and place it in the individual's nostrils, creating a firm seal to ensure that the medication goes into the sinuses, and to press the plunger with a firm push. To administer intramuscular dosage, first remove it from the box and fill a syringe needle with the full amount. It should be about 1 milliliter. Be sure to get rid of any air bubbles and dispense air before injecting. Then squeeze either the arm muscle, the long muscle located on the thigh, or the top of the backside and inject the full contents into the body. Through educating yourself and those around you and knowing how you can help, if the time ever comes to help save a life, you and those like you will be ready to take action. To overall reduce the number of opioid overdose-related deaths there are per year. By understanding the opioid epidemic, completing training classes on how to be a community first responder, and knowing how to administer Narcan, both nasally and intramuscularly, you can help to save a life. By utilizing outreach programs, educating, and being prepared for the number of opioid-related deaths in the United States will slowly begin to decrease. It is important to carry this message with you to encourage others to act. In the words of Helen Keller, "Alone you can do so little, but together we can do so much." The battle of the opioid epidemic is a battle that we must fight together. Thank you.